For many people with kidney disease, a transplant is the best treatment option. Most people who have a kidney transplant do very well, and the risks are generally lower than being on dialysis. To find out if you are suitable for a transplant, your kidney team will arrange a number of tests, and they may ask for a mental health assessment. Why might I need a mental health assessment? Mental health specialists form part of the kidney transplant teams in both Glasgow and Edinburgh. They see some potential recipients, as well as some donors, as part of their workup towards transplant for a range of reasons. For example, you may be referred for assessment if you've had previous mental health problems or you're currently taking medication like antidepressants. What happens in a mental health assessment? The assessment's undertaken by interview, which can be in person or by video. It usually takes an hour or so. Sometimes additional interviews are necessary. There may be questionnaires and rating scales to complete. The mental health specialists do not normally arrange blood tests, x-rays or scans themselves, but they will be able to see the results of tests arranged by other members of the transplant team. The results of the assessment will be fed back to you, as well as to the transplant team, your GP, and any other relevant medical professionals. The mental health specialists may also attend meetings of the transplant team where your case is discussed. What is the aim of a mental health assessment? Well, there are two aims of the assessment. First, to identify any additional risks of transplant which might arise from mental health problems. And second, to do whatever is necessary to keep the risks as low as possible. It is unusual to turn potential recipients down for transplant on mental health grounds alone. Is mental health assessment different from the rest of transplant workup? It's best to think of mental health assessment as a bit like pre-transplant cardiology or heart assessment. Not every potential recipient needs a cardiology assessment, but anyone who has a significant cardiac history, is in current cardiac follow-up, or is taking current cardiac medication might need to see a cardiologist as part of the transplant workup. The aim is to keep the cardiac risks of transplantation as low as possible. Similar principles apply to mental health assessments.